Hypnosis to Change Your Life with Dr. Steve G. Jones.
If you were to work with someone with agoraphobia, how would you go about doing it?
Okay, great question. The way to work with someone who has a fear of something, and agoraphobia is a fear of crowds. People with agoraphobia don't want to go out into crowds, and a lot of times the way this shows up in their lives is that they no longer do the things that they need to do in their everyday lives to make them work. For example, if I need to renew my tag or what have you, and I need to go to the Department of Motor Vehicles. Well, I know there might be a crowd there. There might be a lot of people there. Actually, there will be for a long time. There's people waiting. I know that if I have agoraphobia, I'm going to fear that, and so I'm not going to go. And if no one is going to go in my place, or if I don't have an option of mailing it in, I'm just not going to go. Likewise, if there's some kind of medical treatment I need, and I need to go to the doctor's office, and I know that there might be a crowd in the doctor's office, there might be some people in the waiting room who are sitting there, I might not go, so I might not get certain medical treatment that I need because of that. This can actually lead to death, because if you're not getting the medical treatment that you need, and it's something that's potentially going to turn into something terminal, then you have a real situation on your hands. So beyond just being agoraphobia, it can translate into so many other things when you start to think about the treatments you will put off, the interactions you will put off, and then if we pull it back from that a little bit, we can look at just the life that people will miss out on because they're afraid of crowds. So the way I work with any phobia or any fear, and first of all, I'd never diagnose, but if someone has that diagnosis from a licensed medical professional, the way I work with that is through a way of desensitizing them. And the way that's set up is I have them imagine themselves in a movie theater, and their psyche can be in one of three locations at the same time. So it's a little esoteric sounding, but stick with me here. So they can be in the projection booth running the movie that they're watching. The movie is of their life. They can be in the front row watching the movie of their life, or they can be in the actual movie of their life. And the movie, in this case, is starring them in a crowd of people. So something that'll be very daunting for someone with agoraphobia. Seeing themselves on that screen in a crowd of people can be a little scary. So they can at any time stop the movie by taking on the persona of them being in the projection booth. They can watch it, covering their eyes a little bit from the front row, or they can be in it, but when they're in it, it's only a movie, so it's okay. So the idea is that over time, over a series of sessions, I will have them gradually move up to where they feel, at the time they feel comfortable, to the different locations and to be in the movie. Once I've got them in the movie, I have them interacting as they would in their everyday lives. I can have them make new distinctions, new decisions. I can have them start to feel comfortable with that. Physiologically, the subconscious mind sends out signals just like it would if you were experiencing something. Our reticular activating system, our RAS, allows us to experience things without experiencing them. That's why we cry when we see something sad in the movies, or we laugh when we see something, or we feel someone's pain when we see someone get hit in the movie, because our RAS kicks in. Because of that, we can get real-time experience in crowds without ever going to a crowd.
Really?
Yep. So the old days of the psychologist saying, okay, well, next week we're going to go to a crowd. And we're going to, now I know you're not ready for this yet, but we're going to maybe look at a picture of a crowd this week and maybe go a little closer to a crowd next week, a little closer. Same thing with overcoming fear of elevators or fear of flying or fear of snakes or any fear. They would desensitize in that way. With hypnosis, we understand we can do that all in your mind because of our understanding of the RAS. So you can actually do that in a few sessions without them going anywhere. The next time they go into a crowd, they feel as though they've already been in a crowd successfully. Everything has gone well. So they feel good about themselves, and they're able to then, the idea is, the concept is, which usually does work, they're able to then be in crowds without having this anxiety and to get on with their lives.
But what if they haven't been officially diagnosed?
If they haven't been officially diagnosed with agoraphobia or anything else, we can then say that they have a fear of crowds. And it's very important, by the way, for hypnotherapists in the notes, if they have not been diagnosed by a licensed medical professional, you do not write, patient has agoraphobia. You write, they are afraid of crowds. and that's it. So you would actually use the same treatment, same exact treatment. You just wouldn't label it that way.
Great.
Hypnosis to Change Your Life with Dr. Steve G. Jones.